In this video, I'm going to talk a little bit about the medication that we use to treat autonomic disorders such as POTS and orthostatic intolerance or frequent fainting. In general, when it comes to treatment of these conditions, we like to start with non-pharmacological measures because there are a lot of lifestyle changes that may help the symptoms. But in some cases, we do need to use medication that targets different aspects of the autonomic nervous system. When it comes to the medication treatment, there are three categories. The first is medication that is used to expand the blood volume. The second is medication that is used to slow the heart rate. And the third is medication that acts to increase the constriction of blood vessels in the legs and abdomen and thereby increase the blood pressure. So the first of these is the medication to expand the blood volume. If this is the choice of treatment, the first line would be the non-pharmacological approach, and that is through supplementation with salt and water, and I explained how and why we do this in a separate video. If we do need to use medication for it, the medication used is called Florinef or fludrocortisone. It is a mineralocorticoid, but it doesn't carry the same side effects of corticosteroids. So if you know someone who had been on steroid treatment for treatment of other inflammatory conditions, you may be aware that they suffer from significant side effects. These don't tend to happen so much with the mineralocorticoid. It isn't being given for inflammatory reasons anyway, it's been given to expand the blood volume. It does this by retaining salt and water. In patients who are suffering from POTS and orthostatic intolerance and it is felt that hypovolemia or a low blood volume may be underlying the symptoms, this can be a good choice of treatment. The dose is 0.1 to 0.2 milligrams taken once daily. It has a long half-life, and this means it will stay in your system for a good number of days to a number of weeks after taking it. It doesn't tend to have any immediate side effects. Some people will notice a little bit of bloating, but if it's managing the symptoms, this might be acceptable. In the longer term, it can cause an increase in blood pressure, and this is why it doesn't tend to be used in the long term unless absolutely necessary. Another way of expanding the blood volume is through the use of intravenous fluids. This does give relief of symptoms. However, it isn't really an advisable treatment because the risks tend to outweigh the benefits. At a practical level, you need to have an indwelling intravenous catheter and you will need to be given IV fluids a number of times per week. As most patients with POTS and orthostatic intolerance and frequent fainting are quite young and they may be school age or college age, this isn't really conducive to a normal life. But the other reason is that having an indwelling intravenous catheter carries with it a significant risk of infection. So by getting your fluids in this manner, you are putting yourself at risk of potential sepsis. The next category of medication used to treat autonomic disorders such as POTS and orthostatic intolerance is beta blockers or ivabradine, which is funny channel inhibitor. So these are medications that act to slow the heart rate. So sometimes the symptoms of POTS and orthostatic intolerance, so that being the palpitations, dizziness and lightheadedness, are related to the fact that the heart is beating so fast. So sometimes you can manage symptoms quite well by just acting to reduce the heart rate a little bit. So the beta blocker that is used is called propranolol. This is a non-selective beta blocker. So you can have selective beta blockers which act on the beta receptors in the heart, and then you have non-selective that act on beta receptors in the heart and in the periphery. And the studies have shown that it is the non-selective beta blockers that work best in conditions like POTS and orthostatic intolerance. The short-acting version of propranolol gives the greatest benefit, and its dose is 10 to 20 milligrams 1 to 3 times daily. It tends to be quite well tolerated. It doesn't tend to drop blood pressure too much, which is a good thing, but it can cause cold hands and cold feet, and it can cause nightmares. I don't think I've ever stopped the medication because of these side effects, but they can occur. It also can cause fatigue in some patients, and this obviously isn't ideal given that fatigue can be part of the symptoms of POTS and orthostatic intolerance anyway. It needs to be prescribed with caution in patients who suffer from asthma. Again, it's not that you can't have it if you have asthma, but it is Definitely important that the prescriber of the medication is aware of asthma if you have it, and how severe it is in terms of how frequently you need to be using your inhalers. The next medication that can modulate the heart rate is called ivabradine, and it is a funny channel inhibitor. This acts to reduce the intrinsic heart rate, and it doesn't actually tend to have many side effects, so it may actually be a better first choice than the beta blocker in patients who suffer from a lot of palpitations. It's given at a dose of 2.5 milligrams twice daily, and we don't tend to go beyond 7.5 milligrams twice daily. Another medication that can theoretically act on reducing the heart rate is called pyridostigmine. What pyridostigmine does is it blocks the breakdown of a neurotransmitter called acetylcholine, and having more acetylcholine hanging around your receptors means that the heart rate doesn't increase so much, because the acetylcholine acts more to bring the heart rate down as opposed to bringing the heart rate up. It can have gastrointestinal side effects, but if it doesn't, or if you don't suffer from those side effects, it tends to be very well tolerated, and it's given at a dose of 30 to 60 milligrams 3 times daily. The third category of medications are those that work on constricting blood vessels in the legs and the abdominal circulation, and thereby act to increase the blood pressure. One of these medications that is commonly used is called midodrine. It is given at a dose of 2.5 milligrams 3 times daily up to 10 milligrams 3 times daily. This medication acts to increase blood pressure, so the reason it is used in patients with POTS or orthostatic intolerance is that if theoretically the heart rate was increasing in a compensatory manner to compensate for blood pressure dropping, but the blood pressure was maintaining upright or maintaining as normal because of the increased heart rate, that actually increasing the blood pressure might then negate the need for the heart to increase its rate. And this does work in some patients. It's important when you're taking midodrine to understand that what it is doing is trying to increase your blood pressure. So it's not really of any use if you're going to be lying down. The timing of the medication would be 8 a.m, 12 midday and 4 p.m. and I wouldn't advise that you take it within 4 hours of going to bed. If you happen to have a nap and then you woke up and you realise you'd taken your midodrine, there wouldn't be anything unsafe and there wouldn't be any cause for concern here. It's just more that it isn't of any value to increase your blood pressure when you're lying down. So if, for example, you thought you were going to take a nap but you were due your medication, you could wait until you woke up to take it. So there's a few practical things about the midodrine that are worth knowing if you are going to be on it. Also, if it came to 6 or 7 in the evening and you were in for the night and you realised you had skipped your third dose by accident, or you hadn't the tablets with you when you were out, there wouldn't really be any value to taking the medication unless you were feeling very symptomatic, because again, you're going to be lying down. Its onset of action is within about 30 minutes and it lasts about 3 to 4 hours in your system. It doesn't tend to have many side effects, but I have had some patients who've got headaches while they've been on it, or a prickly sensation on their head. These two side effects can be limiting in terms of taking the medication, because they're not particularly tolerable side effects in my experience. The other medication that can act to increase the blood pressure is called droxidopa, and this acts to increase the amount of the neurotransmitter norepinephrine in your system, and thereby increases your blood pressure. In general, this is a medication that I've only really used in an older patient cohort, because when they suffer from a condition called orthostatic hypotension, which is where the blood pressure can't be maintained when they're standing up, droxidopa is a good medication for them because it doesn't tend to cause an increase in their blood pressure when they're lying down. Its dose is 100 to 600 milligrams and it can be taken 3 times daily. The last medication I'll talk about doesn't really fall into any of the categories just described, but it is a sympatholytic medication, meaning that it reduces sympathetic activity. It is called Clonidine and it is given at a dose of 0.1 to 0.2 milligrams 3 times daily. In general, it is well tolerated, but it can cause profound fatigue. So it doesn't tend to be the first line medication. We would go to that one if someone was struggling with their symptoms in spite of trying other medications. But again, the fact that it can cause a lot of fatigue is definitely a limiting factor, because fatigue can be a huge component of all these autonomic disorders anyway. So I hope that's of use. Just a quick run through of the medications that you might be advised to take if you are suffering from an autonomic disorder.